Ladies and gentlemen, from the capital city of Georgetown, Guyana, the land of many waters in South America, please welcome Lady Wendy.
Pleasant good evening. This is the Lady Wendy Show. Once again, I'm come to you with our topic being cancer awareness. As you know, this is the month of cancer, and Lady Wendy could not have let this show pass without bringing awareness to you. Joining me today, we have Dr. Tariq Jagnarine from the University of Guyana, who is going to be telling us about the different form of cancer. Also, we have Tessa Johnson, a survivor of cancer, who has had 5 operations on her breast but had not had it taken off. And also we have young musicians in the house who are going to play you some nice soothing music, because we want to be able to inspire and encourage Guyanese talents out there. And of course we have nurse Morris, who is going to break it down for you. As you know, it's very critical when you are out there, you need to screen. She will talk to you about the importance of being tested, important of having that mammogram, that's pap smear, and to you young women out there, the importance of having the HPV vaccine. So today it's a packed program for you. And also we are having none other than Marva Langevine, who has had a friend who has died from cancer, and she will tell you about her role in all the programs and the different things that she's doing out there in the community. So once again, it's going to be a day of lots of information, most importantly, that you can use or you can share with someone out there. Sit back, we'll be right back.
Choose Tennessee Shipping. 28 years of reliable services. We ship barrels, furniture, vehicles, excavators. Just call us at 905-405-8227 in Brampton, Ontario.
Hello. Thanks for coming.
Hello, Lady Wendy. Thank you for having me.
Well, I'm very excited that you're here. You're Dr. Tariq Jagnarine. Am I saying it correctly?
That's correct.
Okay. For those who are listening, Dr. Jagnarine is a doctor, but he is also in his final year at the University of Guyana, specializing in family medicine.
Correct.
And what is family medicine anyway?
It's one of the new specialties that have been offered to basically bring about a holistic approach in seeing patients when they come to you. Approach where you can, at a primary level, help persons from basically of what happened to go to the hospital. We see the entire picture. We care for patients, basically we like to say from cradle to the grave.
Oh wow.
Yeah.
Wow. Well, I mean, I'm an old senior, or what you would say mature senior coming up, and of course having that holistic approach. I mean, medicine has emerged from I guess ancient time to now, that and with the emerging aging population, I think all these things would be necessary at some point in time. Now, cancer, as you know, this is the month of cancer, and that's why you're here.
Yes.
Now, could you share to the viewing audience out there, because I mean, it's most of us have heard, as I said earlier, about cancer. But could you tell me a little bit more about cancer for who don't know? What's this all about, and what are the most prevalent ones that are affecting Guyanese or Guyana in particular?
Definitely. First of all, I would like to say that cancer is everybody's business.
Okay.
And it's something that it's not new. It's been happening from eons. And in Guyana, the stats shows that we have quite a number of different types of cancers that would affect us. In terms of the top ones, we can have breast cancer as number one. Number one diagnosis of cancer, and as we know, it's Breast Cancer Awareness Month. Mm-hmm. Cervical cancer, number 2. We also have prostate cancer. Many men are unaware about this. It so happened that prostate cancer happens to be the 5th leading cause of death in Guyana in terms of total diseases. There are cancers like colorectal cancer that affects the colon and the rectum. You have ovarian cancer. You can even have lung cancer as well. Mm-hmm. There are quite a number of cancers out there. It's not saying that they're not that frequent. They happen, but of the top 6, those are the top 6.
Oh, wow. Now tell me something. Since breast cancer seemed to be one of the top ones, what are the risk factors in those form of? Could you explain that to me?
Lovely question, Lady Wendy, and it's something that where you see the difference in what a family physician does. We, by seeing patient holistically, we're able, when you come for an acute event, maybe a cough and cold, we just only don't look at that. We explore your entire background and look for those risk factors, things like your age. Many persons who, as they age and in their elderly stage, especially above the age of 40, they can start presenting with issues of breast-related cancer. Their race. Although it's quite frequent in Caucasians, it's the more advanced form of the disease is found to be in the African race. Also, you look at things as persons' weight, right? Those persons who are obese, who smoke. Smoking happens to be one of those factors that transcends throughout all of the cancer realms. As one of those, every single one of the cancer that you find, it's one of those factors that the people we try to change as much as possible. Alcohol use, inactivity or diet of fatty foods, estrogen use. This is basically persons who would use hormonal pills, among many other factors that they're now discovering. One of them that I recently read, it was quite perplexed, is night shift workers, women. They have a propensity to develop breast cancer because
Hold
of
that
shift.
thought, because you have me worried, because more and more women are being taking up these, and a matter of fact, I talk about that, but I talk of it from a more social, a social mandate of leaving their children at home. But you're telling me that even though that they're going out to work at night, the possibility exists that it may also create. And why is that? Is that because of stress? Is it not lack of sleep? Why do you, I mean, you may not have the answer, but give it on a more personal
So I was quite as alarmed as yourself.
Okay.
So what the research is showing is because of working at night, there's a specific compound that produces at night called melatonin. And it has some relation that women working at night, that amount of substance isn't produced. And so it can lead somewhat to that. The results, the statistics are not that definite, but it's pointing to
because
that
it's now
direction.
being tested in the infant stage.
Definitely.
Oh, well, you hold that thought. We'll be right back. When we get back, we want to talk about prostate cancer, because you men out there, you sit back and come back to listen to Dr. Jagnarine talk about prostate cancer.
Planning a wedding or an outdoor event? Call Star Party Rentals. As Guyana's largest event rental service, we have the expertise, professionalism, and quality equipment to make your event a cherished memory. Star Party Rentals for weddings, quality tents, lighting, chairs, tables, linen, dance floors, projector screens, and everything else that you need to make your vision a reality. Save money elegantly by calling Star Party Rentals today at 226-3020.
Well, I'm back. We will just continue our conversation with Dr. Jagnarine, who is a family medical student at the University of Ghana, who is a doctor already, and he is breaking it down for us as it relates to cancer. Oh wow, it's some staggering statistics that he is thrown out as it relates to workers and women in form of breast cancer. So, Dr. Jagnarine, you tell me, you have me puzzled with what your last comment, but what I really want to talk about now is about prostate cancer as it relates to men.
Very interesting topic. Like I would have mentioned, that prostate cancer happened to be the 5th leading cause of death in Guyana. Many men out there, they're so reluctant to come and see a physician. I think because of they want to be macho, they would wait until maybe a disease advance, then they come and see physicians. But most often, men who, as they age, especially about from the age of 60s onward, they can start presenting with changes in their urinary habits. And so once you start noticing, for example, you would notice that your urine stream would decrease. You might notice instead of having a straight stream, sometimes the stream start splitting. Persons might be having drops afterwards. They would have finished urinating and they're still having drops. Many times persons, they can't even hold that urine in and they have to rush to the washroom to get the urine out. You would have cases where persons have at night time, they would urinate a lot. So noticing these small changes should motivate men to visit your nearest health center or clinician, discuss with him. Right? And the clinicians are there who generally would do a bit of screening on you, go through the symptoms with you, and then to see if you might be presented with a cancer. Often it might not be cancer, but it's a good thing to start. It's
Yeah,
better to know
because
before.
preventative, as you know, is always better. Now, you mentioned that that they will perhaps the macho-ness. So you're going to allow your macho-ness to take you to your early grave, I would want to say. Because if you get early detection, then you can probably correct the issue.
Definitely.
I mean, so now, but I think one of the things, if I recall, the problem with a lot of men, well, I mean, in North America, having lived in North, is the actual procedure
Yes.
for testing for prostate, where
Yes.
you have to have
A rectal exam.
a rectal exam,
Yes.
and that's where the issue lies.
Yes. Yes.
Having a doctor, because I know I think it was one of my brothers when he found out, who's older than me, he said, "We are not me." But in the end, of course, because it's a serious matter, that there's nothing wrong at the end of the day having that done. Now, what are the preventative methods would you say, apart from being tested as cancer, because you can't really prevent anything? What would you recommend in terms of diet in any form of cancer?
Interestingly, to add what you say, that even though way back doctors would have done a rectal exam on men, research is now showing that that is not that conclusive. So you might visit your clinician and he doesn't do a rectal exam. So there are preventative steps we can take. Some societies, medical journals, they would encourage to do a test called a PSA, a protein-specific antigen test. It can guide you, but still, it's still debatable in terms of its role. But in terms of our lifestyle, principally avoiding smoking, like we mentioned, is one of the principal causes. Alcohol use, having a proper diet. It's encouraged to have what you call a Mediterranean diet, a diet that is more rich in peas, beans, nuts, fruit, vegetables, instead of going more to carbohydrates and a lot of fatty food. And like I also mentioned, go and see your physician. Do not wait until you're 60 or at the point where this disease is so advanced, then you want to see a physician. Doing these simple steps, it can help you.
Well, I kind of like the fact that you talk about alcohol use, because I do find that in Ghana, alcohol seems to be, drank very frequently,
Yes.
almost every night. So
Yes.
we would be having
Yes.
quite a few men experiencing prostate cancer.
Yes, well, it's a factor.
I mean, it's
definitely.
one of the factors. We don't want to now scare people
Yeah.
to thinking, oh, if I drink, I'm going to get it.
Yeah.
Just like what we said earlier, we want to also, with the women working now, they want to stop
Yes.
working because this doctor say that on the television. We just want to say that it's one of the factors that could cause cancer.
Yes.
Well,
definitely.
I thank you for coming to the Lady Wendy Show. I do believe that I'd like to have you maybe one-on-one so we can talk some more about this cancer, because I think that it's something that we need to have out there, bring awareness to this I call awful disease that is seen to be taking a big part of Guyana society, because usually it would have been more diabetic and so that killing
Yes.
people, but now every time you turn, you're hearing it's cancer. So I thank you for
Thank
coming.
you. Thank you for having me.
All
It was a
right.
pleasure.
Soup Bakery, 9 years in existence in Toronto, Canada. So my fellow Guyanese, you don't need to bring tennis shorts, Salara, roti, or even pint or black pudding in your suitcase from Guyana. Don't go through the hassle. Right here in Toronto, you can find these products at Norman Soup Bakery. So check out Norman Soup Bakery. Remember the name.
As we continue this discussion on cancer and cancer awareness, we could not have covered cancer without looking at survivors of cancer. I mean, this is one of the most, I think, emotional side of cancer. Once you find out that you've got cancer, the chances of, turning your life upside down, because I know for sure I've had persons who had cancer and who has also passed from cancer. So today I give God thanks for my next guest, because she's a survivor of cancer. Welcome, welcome. This is just Tessa Johnson. Welcome. Well, if you see, you could never judge a book from a cover, because looking at you, You look fantastic. Everyone say, oh, this is what a cancer survivor looks
Yes.
like. And now tell me a little bit about yourself,
Okay,
Ms. Tessa.
thank you for having me.
All right.
My name is Tessa Johnson, as you mentioned before. I'm 52 years old. I have 2 children. I was diagnosed with breast cancer at the age of 33.
Wow, that's very young. Very, very young.
Yes, and when I was diagnosed, I was told by the doctor that my cancer was being fueled by estrogen. My body was producing excess estrogen. If you know what estrogen is or what it does to the body, it's a steroid component of the body that helps a woman to produce breast milk or a period. That sister in having her period.
Right.
If your body produces excess, it means that you will have excess menstruation. It's like twice a month.
Oh.
Yes.
Uh-huh.
And being almost mid-30s, childless, never been pregnant before, the estrogen level is up, way up. You're supposed to be nursing a child by then. And if you do not, yeah,
Then you're in serious.
serious problem.
Okay.
So the doctor said to me, I will treat you and help to decrease the amount of estrogen that your body is producing. And if he does that, I might not be able to bear a child because I will be forced into early menopause.
Uh-huh.
That was
So
the problem.
now, I mean, I wish the doctor who just left here could answer a question, because I do have, even in fact, someone close to me who is having their menstruation twice per month. Should that cause for concern?
Well, I'm not a medical practitioner,
Right.
but from what was explained to me, the estrogen has to be released from your body.
Okay. So you've had breast cancer, and
Yes.
you said to me when I spoke to you earlier that you've had a total of 7?
5.
Okay.
5
surgery, and you didn't have a complete
Mastectomy.
mastectomy.
No, I didn't, because I visited an oncologist,
Okay.
not just a medical practitioner.
Okay.
And he said to me, mastectomy is your last option.
Wow.
You were young, so do the lumpectomy. I did the first 3 surgeries in Guyana.
Okay.
And when I did the first one, I wasn't told that I had breast cancer.
Oh, you weren't told, so why did you
No,
do
they just did a lumpectomy. They removed the lump and
Okay.
they said
But they
it
said
was-
you had a lump,
Yes,
obviously.
they said it was fibroadenomia.
Okay.
And it was nothing to worry about.
All right.
But within 3 months, I had another lump.
Okay. It just
Within
recurred.
6 months, I had another lump.
Okay.
And both times, or all 3 times, I did lumpectomies.
All right.
But for the last 2, I went to this doctor by the name of Dr. Walter Chin,
Okay.
and he treated me.
Mhm.
Dr. Lee was the surgeon at the time. And I think they were trying their best.
Yes.
And they said to me they will treat me. But then, when the incision wasn't healing, they realized that something was
Yes,
definitely
something wrong. That's right.
And they said to me, you know what, we can't help you. You have
Yeah.
to seek medical
Oh,
attention
okay.
overseas.
Overseas, and that's where
what they
you
said
went.
to me, yes.
And then you didn't have to do a complete removal of the
No,
breast.
when I got there,
Which is rather interesting, I must say, because usually they tell you, if you're going to continue to do surgery, is to have it removed, but you were told not to.
not to, yes.
All right.
Because for the fact that he said to me, when you do a mastectomy, and because your cancer was aggressive, it will go inside.
Oh, that's rather interesting.
Yes.
And since then, you were able to have 2 children.
Yes.
So it's probably, you
Yes,
needed
it
those
was-
2 breasts anyway.
I didn't, because the left breast that was mostly affected didn't produce any breast milk.
Okay. Okay.
So I nursed both of them on one side,
All right.
the right side, and that had enough. But the doctor said to me, nurse them as
Oh,
long as you can,
okay.
so that you can express the milk.
So now that how long, could I get that corrected, that since you've had those surgeries?
Okay, my last surgery was in 2007.
Oh, 2007. So almost 11 years.
Yes.
Okay, and you're fine? Well, you're
Yes, I'm
definitely...
fine. Yes, I'm fine.
Do you have to go for yearly screening?
Yes, I do.
All right.
I
Are you
was
nervous that it might come back, or you really...
Yes, I am.
Okay.
Every day, I live the best life.
All right.
Because there's no cure for cancer.
All right.
And yes, I'm scared.
You're scared, but
Yes,
you survived it. Your kids are 16 and 17, that was told.
And I believe in God. I trust Him. When my time has come,
you're ready.
Yes.
Now even if you're not ready,
yes,
it becomes ready.
I would have lived my life. I would have brought my kids into this world.
Mm-hmm.
I would have seen them grow to a certain age because that's what I prayed for. So I'm happy.
Well, I tell you this evening, I am very proud. I'm very happy. You kind of bring a bit of emotion to me because I've lost a very good friend to cancer, cervical cancer. So and every day I have folks that I know, because this disease is, but it's nice to see that you've overcome. And thus far,
Yes.
you're able to beat the disease, and you're here, and you also were able to have 2 wonderful children.
Yes.
And but as you say, you're ready for whatever may come your
Yes,
way.
whatever. And I would like to say one thing. People often ask me, why you always in braids, or not braids, why you always in extensions and wigs?
Mm-hmm.
But because of the chemotherapy, I lost my hair,
Mm-hmm.
and it hasn't grown back
Okay,
that well.
that's all right. That's
Yeah,
all right.
so
'cause
I just want to put it out
weed,
there.
I know, but I know you wanted to put it out there, but also people are in weave and all those things, and
Yes.
they don't have it, so
Right,
you don't even need to explain it to anyone. So, and my final note though, you're physically okay. You're
No, I'm physically okay, but I'm easily fatigued
easily fatigued.
because I'm still on like meds,
Okay.
but not much, that
Okay.
much.
All right.
And so I'm like constantly fatigued, so I just take it easy. But
One day at a time.
Yes.
Well, I thank you for coming down to the Lady Wendy
Thanks for
Show.
having me. It was a pleasure.
I will keep in touch with you, and I
Yes.
know that all will be well.
Yes, I know
because
that.
you've come thus far, and I know that there's another
Yes.
leg coming your way.
Yeah, thank you
Thank you for coming to the
so
Lady
much
Wendy
for
Show.
having me.
It is commonly believed that all oils are alike. This might be true in looks, but not true in its performance abilities. So for all genuine Mercedes-Benz, Audi, Toyota, Honda, Mazda, Mitsubishi, Subaru, Nissan motor oils, automatic transmission, and CVT fluids, visit Car Care Enterprise at 43 Hatfield Street, Stabroek, Georgetown, and Performance Bus Service Center at 17 Durban Street, Working-Rust, Georgetown.
Hello. Well, we are talking about cancer awareness, but we thought we would tone it down a bit with some music. And one of the things Lady Wendy like to do is to feature Guyanese talent. But this one is very new, so cut them some slack. They're amateurs. But what I love about their story, we have here Roshana Hamblin. All right, and we also have here Mr. ONeil Bess, and one of the things that I love about their stories is that on Sunday they just get together with some nice music in the garden, and he would sing and she would play the guitar. So I thought, why not? Let's listen to them. So, but before we listen, I want to just ask them a little bit, like, what got you started on this kind of? It sounds very romantic if you ask me. I'm going to put you on the spot, but go on.
Well, Roshana and I met at Assembly of God Youth Camp about 2 years ago.
All right.
And we just was outside of the chapel, and she played this game called I'll Give You Words, I'll play the guitar, you make a song out of the words. And I was one of the persons playing the game, and we just started vibing.
Okay.
And we met a year afterwards in town. I collected her number, and we recently started playing together in the gardens.
And you write, you like the writing, and she would play whatever you write. Oh wow! And guitar for a woman. This is awesome.
Yes.
Because my husband plays a bit of the guitar. Him and his brothers are young. What made you take up guitar playing?
For me, I always like things to be different.
Okay.
And for a girl to play a guitar, it seemed far-fetched.
You like to set the trend,
Yes.
eh? Good for
Yes.
you.
It
Okay.
seemed far-fetched, and I like the sound it gives. And I like the fact that when I'm holding the guitar, I feel the vibrations of the string. So it means a lot instead of just playing through the keyboard or so. So I actually feel the music.
Wow, I mean, I'm just feeling the music, just hearing you feeling the music. And so I am very, very excited about listening to you. And so you go on a Sunday and you would play. Now, you're planning to at some time hit the America, or this is just for the hobby? What are your thoughts around that?
Okay, anything I do with purpose.
Okay.
So I'm not just going to, of course I love it. I love playing for people, etc., etc. I've been playing since 2008, right? And of course I would want to take my music to another level. Like, I want to be a producer actually.
Oh.
So yes.
We need to talk. Go on. I'm in the entertainment business. Go on.
Yes. So I would normally not only play guitar, but I build beats also, like tracks. So I have been working on a series of projects. Yeah.
Well, listen, you could get grabbed up from the Lady Wendy Show, but go on. So you have with purpose. So you
Yes.
hope to see yourself as a producer of music.
Yes.
Do you also write?
Yes, I write also.
Okay,
Yes.
so you're very talented. Well, I love music. When you have music in your soul, I love music, but I'm sorry guys, no instrument, and I can't sing. I only sing in the shower. But I love to promote people who has that. I mean, we all have, God give us some kind of talent, and that's your talent.
Yes.
So I thank you for coming to the Lady Wendy Show. So let's hit it!
Thank you for having me.
Alright, so this is an original piece written by Roshana and myself. Enjoy.
Let top-notch employment services be your first stop. to secure your first job in Canada. We have been around for 26 years and we have helped thousands and thousands of new immigrants settle successfully in Canada. Please call us at 416-741-0066. I repeat, 416-741-0066.
For all your advertising needs, it's the LadyWendyShow.com. Remember, the time to advertise your business is now when sales are low. Don't wait until you're out of business to complain. Act now. Advertising does work. Ask Ronald McDonald. Call for advertising rates at 225-4494 or info@LadyWendyShow.com. Remember, 225-4494 or info@TheLadyWendyShow.com.